practitioner, academic nurse educator, trained sexual assault nurse examiner, SANE, researcher, publishes, author, and invited speaker. She served as director at large for ANA New York and as president for a local chapter of NAPNAP. Dr. Bono-Neri is a recipient of a prestigious N.E.F scholarship. In giving back, she has established an N.E.F scholarship to be awarded annually to a master's or doctoral nursing student pursuing clinical expertise or scholarly work pertaining to human trafficking. Due to her dedication and global impact surrounding human trafficking, Dr. Bono-Neri was inducted as a fellow into the American Academy of Nursing and was recognized at the United Nations, receiving the 2024 Inspiring Global Nurse Award and 2024 International Ceca Award. She's the co-founder and president of Nurses United Against Human Trafficking, PI, a global professional association dedicated to educating, equipping, and empowering healthcare professionals on human trafficking and anti-trafficking measures. Again, thank you very much for being here, Dr. Bono-Neri.
Thank you so much. Good morning, everyone. Thank you so much for being here and for all that you are doing. This is a very dark space, as all of you know, those of you who are working in this or contributing in some way, shape, or form to combat it. It's a very difficult thing to be a part of. However, it is a calling placed on our lives. I am a woman of faith and truly feel that this was something that God placed on me. And I have picked up that mantle and am carrying it forward, doing whatever I can to educate, equip, and empower healthcare professionals in particular, as that's my niche, on human trafficking and anti-trafficking measures. So truly, it is an honor and blessing to be here with all of you. Thank you so much for joining. I am going to share my screen and I will start the presentation. So this presentation is entitled The Intersection of Human Trafficking with Healthcare, What Frontline Workers Are Seeing But Missing. Please, if you would like to hold on to my contact information, our website is www.nuaht.org. NUAHT is the acronym for Nurses United Against Human Trafficking. My email is info@nuaht.org. After this presentation, I will certainly open it up to Q&A. If there is anyone who would like to have a private conversation or needs to jump off before that Q&A session, please feel free to contact me. You can contact me via email, again, at info@nuaht.org. You can also go to our website of nuaht.org, and there is a tab at the very end that says contact us. You can communicate with me that way as well. So just a little housekeeping, right? I have nothing to disclose and there are no conflicts of interest that exist. This, of course, will be triggering content. Perhaps some may feel uncomfortable at one point or another. Please feel free. Oh my goodness, what is happening there? Pardon me, 1 second. I need to take the timings off. It likes to have a mind of its own. Okay. All right, let me go back. So if you need to take a break at any point in time, if you are feeling uncomfortable, please feel free to do so. You can walk away from your screen. You can mute it. And again, if there is anyone who would like to engage in a conversation afterwards privately, feel free to contact me. So just some learning objectives. We are going to explore the significant intersection of human trafficking with healthcare as these clients are coming in presenting with diverse acute and chronic healthcare concerns, mental health needs, substance use disorder, near overdose, a variety of different complaints, diagnoses, comorbidities. So they are accessing healthcare at exponential rates. Unfortunately, what is happening, we are going to recognize a significant lack of preparation for healthcare professionals on human trafficking and anti-trafficking measures in order to promptly identify, report, if in those cases involving minors, appropriately respond, and provide trauma-informed care. We are going to identify diverse clinical presentations and red flag indicators of a victim of human trafficking. Now, perhaps some of you are actually in the healthcare professions. Please, this is very important that you understand some of the different ways that these individuals are presenting in the clinical setting. There are a lot of nuances and subtleties. Unfortunately, some of these 1 and 2 hour trainings, as much as I really acknowledge them and applaud those who are making them, it is insufficient. There are so many diverse clinical presentations. It really runs the spectrum of how they are presenting and what is happening beneath the surface. You know, we are only seeing just the exterior or some of the subjective data that they are presenting with. In the interim, of course, they are being coerced and compelled, and there are scripted stories that they are coming in with. Perhaps they are coming in with that domineering figure, that trafficker. Perhaps it's a bottom, as one of the terms used in human trafficking. It's a part of the lingo. And so they are not going to disclose. And again, so it is falling on us as healthcare professionals when they are coming in to be able to recognize those cues, both verbal as well as nonverbal, so that we can appropriately intervene. So here is a video. So, being the nature of this platform and all of you who are on here, I know that you are well aware of what human trafficking is. But just again, to really dive into some of it, please do not be blinded by the myth that human trafficking is happening in these underground areas or countries that are socioeconomically challenged. It is happening everywhere. It is happening truly globally. It is happening in schools, within our borders, within our communities, within our faith-based organizations. So, of course, human trafficking is a global humanitarian crisis. It is a public health crisis. It is occurring, I'd say, in every community. I just can't prove it, right? Because this is a very hidden in plain sight type of criminal enterprise. We know that it is vastly underreported. It is the compelling of a person through force, fraud, or coercion to provide some type of labor or service. It's happening in homes. It's happening in hotels, motels, streets, agricultural industry, the fishing and crabbing industry, healthcare. We actually have healthcare workers who are being labor trafficked. Manufacturing, online. You can order labor or sex as easily as you order an item from Amazon. What it is not, of course, we understand that with the word traffic and as the root in the word trafficking, human trafficking, there is this misnomer that it is a transportation-based crime. Human smuggling and human trafficking are very often used interchangeably, but that is incorrect. Human smuggling is the voluntary wish for someone to come across a border of a country, evading those laws that are in place. So human smuggling is a transportation-based crime against the borders of a country. Human trafficking is an exploitation-based crime against an individual. Now, not everyone who is smuggled is trafficked, and not everyone who is trafficked was smuggled in. However, certainly there is an overlap, because those who are smuggled in, now they have to pay off that fee to be smuggled into the country. And so now they are finding themselves in debt bondage. And therefore, sometimes in order to pay off that fee, they are being exploited in this capacity. It is not prostitution. Again, used interchangeably but incorrectly for sex trafficking. Prostitution is someone who is a sex worker who chooses voluntarily that there is no one controlling his or her finances, that is engaging in commercial sex in order to gain revenue. But please understand that although it is a voluntary choice, these are the people who are provided the least amount of choices in life. It is not just sex trafficking, right? Although sex, probably because it has the word sex, that's why there's so much buzz about it and is so prominent on social media platforms, news outlets, as well as these Hollywood films. There are obviously other forms of trafficking, which I will dive into in just a moment. Again, it's not just happening in other countries. It is happening all around the world. Here, domestically, we had the movie Taken and Sound of Freedom. And as much as I appreciate the awareness that was raised by these movies, they are depicting it that there's the ropes and chains, and that's not necessarily what happens. There is a lot of psychological manipulation, and so the chains truly are psychological in nature. It's not the white van or the abduction from the supermarket, right? These are different forms, and what we are finding. Oh, again, I'm sorry. Here's trafficking versus smuggling. This is the actual definition according to Homeland Security Department of Blue Campaign. So it is not that creepy white van, right? This online, our devices, this is the new domain. With my generational experience, I'll put it that way. I'm a little bit up there in years, and I knew growing up I had to fear the white van, but this, I don't know if everyone can still see me that I'm sharing my screen. I'm holding up my device. This is the new white van, right? There, I mean, look at all of us. We are able to communicate from all across the world. And so these traffickers, these master manipulators, these predators, they recognize that there are no more geographical boundaries. And so everyone is online in some form through digital communication, social media, gaming apps, right? And so they really have an infinite number of victims at their fingertips. And when we look specifically at minors, at children, they're on social media, they are on these gaming platforms. And as parents, unless we are truly aware, we do not recognize those risks that these platforms are providing, because we can lock our doors, we can lock our windows, but you give a child a device and you literally are letting the predator in. So there is labor trafficking. These are the different forms. There is sex trafficking. There is forced surrogacy, forced criminality, domestic servitude, organ trafficking. It is approximated that 10% of organs used in transplantation have actually been obtained through trafficking and obtained from either the black or red market is what they're called, depending on the type of tissue that is obtained. Sextortion. I have another video that I will be playing.
Oh, Carter, you're on fire! No joke. And hey, have pity on the new guy.
Not gonna happen.
Oh,
Nice.
yeah!
Okay, pro gamer. Dinner time.
Gotta go, guys.
Hey, it's Carter, right?
Mm-hmm.
I think I go to your old school. Wanna join my chat and play some PvE later?
Yeah, I'll be right back.
Hey, what's up?
Hey, Dad, we have a new guy in our squad. His KDR is insane.
Huh.
Yo, I'm back.
Nice. Hey, I don't recognize you from school. Did you guys move?
Yeah, we're in Westlake now.
Cool. Well, if we're gonna team up, you can't be looking like a scrub. Here, take these credits and unlock the Dark Void skin.
No way. That's worth like 60 bucks. Thanks, bro. The squad is gonna be jealous.
Oh, my girlfriend's coming soon. Hey, are you with someone?
No.
Wow, Carter the loner has big evening plans with his parents.
Nah, my folks are busy. They let me do whatever.
Hey, I think I know a girl that'd be into you. Snap some pics and I'll show her.
Wow, you're joking, right? Come on, show some skin.
Go harder, bro. Show the girl what she wants to see.
Carter.
Nice. That's more like it.
Kinda stupid, though. You know I'm showing these to your friends over at Westlake Middle School, right? Your life ends when I hit send.
What? Are you kidding? No!
Relax. As long as you do me a little favor, I can make sure nobody sees these pics again.
Honey, I'm worried about Carter. He's always online with that new friend.
Yeah, I know. I'll talk to him on the way to school tomorrow.
Good. Something doesn't feel right. It reminds me of an article I saw the other day about online predators. I'm gonna look it up.
Send me the link when you find it.
So this was a video made by the Blue Campaign on sextortion, which again, these are exploitation-based crimes. And the numbers that this is happening, it's truly astronomical. And a lot of these young boys, which predominantly are targeted, they have taken their lives because they feel that there has been no way out. And look at some of the numbers. So NAPNAP is the National Center for Missing and Exploited Children. And on their website, you can see from 2026, this year, approximately 63 million total files, which included images, videos, and other files related to child sexual exploitation, were included in reports to the cyber tip line in 2024. And you see here on the right-hand side of the screen, children can become victims of online grooming in as little as 17 minutes. So games and apps predators use to engage with minors. These are some, again, a lot of you recognize them. I'm sure, again, being the nature of this this organization and this platform, I know that a lot of you are already aware of this, but studies are showing that upwards of 70% of parents are reporting that they have no knowledge of their children's online presence. And so again, here we're thinking that our children are safe, or perhaps our grandchildren, our nieces, our nephews, our younger siblings, right? And these truly are predatory sites. They are grooming them. They are taking them to a separate chat platform. And that's when the grooming process starts. And so these children are not necessarily being abducted, but they are rather running to this promise of a better life. And so they literally are running away, which increases their risk, of course, again, of being exploited. So was slavery ever truly abolished? I don't know if all of you truly know the history. We look at the history of human trafficking and slavery because we know that it is known as modern day slavery. And so there was the Emancipation Proclamation in 1863 announcing that all persons held as slaves within the rebellious areas are and henceforward shall be free. The 13th Amendment passed by Congress, again, January 1865, ratified in December of the same year. Slavery was abolished here in the United States. But was it Human trafficking is not new, and one of the earliest recorded forms of trafficking was actually Joseph being sold by his brothers into slavery. But when we look specifically at this country, there is the Page Act, and I'm in Florida. I was originally from New York. I know that my accent is still very thick, so some of you may recognize that. But I do live in Florida now for the past 5 years. But here within our country, the United States, the Page Act of 1875, which was signed into law by President Ulysses S. Grant, made it unlawful to import women into the U.S. for immoral purposes. And then also to import any person into the U.S. for the purposes of forced labor, debt bondage, or peonage. The Mann Act of 1910, which was known as the White Slave Traffic Act, and it's not necessarily that it was trying to delineate race, but this was to ensure that people understood that the white slave traffic specifically spoke of commercial sex acts and women being used for, again, these immoral purposes. And so the White Slave Traffic Act of 1910, named after Congressman James Mann of Illinois, made it unlawful to transport women across state borders, state lines, I should say, for prostitution, debauchery, or any immoral purposes. It actually was revised in 1978 and again in 86 to make it more inclusive of all people. So again, really dating back 1910, 1875. And then finally, of course, where we have the cornerstone legislation that was signed into law October 28th of 2000 is the Trafficking Victims Protection Act, again, here in this country, which goes through the elements of the crime, the AMP model, the how, what, how, and why, right, which is the actions, means, and purpose. Of course, anyone at the federal level, this is speaking, anyone under the age of 18 who engages in a commercial sex act, we do not need to prove force, fraud, or coercion. It is human trafficking. It is a crime, and it falls under mandatory reporting guidelines. We have the 3P paradigm, of course, which started as prosecution, protection, and prevention. And then the fourth and fifth were added of partnership and policy. But please note, there are more slaves today than ever before in history. When we look at the profit made from human trafficking, so here we have $150 billion. These were based on older metrics, these numbers back from 2012, I'm pretty sure. Unfortunately, some people are still citing them. In 2024, NASDAQ and Verifin actually put out their report on the global financial crime report is what it is. So this was, I want to say, back in April of 2024. It was approximated that human trafficking was grossing globally on an annual basis about 350 billion. They just put out their updated report. I want to say it was just last month. It is now up to about $530 billion, and it's growing with an annualized growth of 23.5% every year. And, you know, I mean, that number in and of itself, we just can't even conceive of this number, but I'm going to put it into perspective that really makes it tangible. This number of 528.5 billion actually exceeds the combined revenue of Nike, Google, and Starbucks on an annual basis. Human trafficking is a financially motivated crime, right? And so when we look specifically at sex trafficking, women and men, please understand that both male and female are being exploited for sex trafficking. There is, you know, the depiction, that stereotype where it is always a younger female with a domineering older male figure. No, that 10-year-old boy who keeps coming in to see the school nurse for chronic headache or chronic bellyache, those somatic complaints, where Johnny is being labeled as, you know, that difficult student, or he doesn't want to participate, he doesn't want to sit in class. In the meantime, he could be the victim And mom actually could be the trafficker because there is such a thing as familial sex trafficking, FST. So when we look at human trafficking, these individuals, people, are literally stripped of their freedoms, and they are now viewed as a commodity, a human product. And unlike a drug or an illicit arms trade, once that product is sold, is traded or whatever it is, that product is gone. But a human being can be sold over and over and over again. And so this is where these clients end up coming in to be seen, because if that trafficker is not profiting off of his or her product based on a cellulitis, near overdose, an infection of some type, they're coming in accessing healthcare, and this is when we can see them. But when we're looking at an approximate revenue from one individual, you're looking at about $250,000 for one person. And this is just based on a random approximate 20 commercial sex acts in one day. And believe me, I've had survivors report up to 30 and 40 per day. There are quotas that are set that they need to meet. And if they are not met, these individuals are beaten, they are threatened. I mean, the acts are just heinous, egregious crimes. But now when we're looking at this, 20 sex buyers or Johns, right? And please understand that every single encounter is a rape because they are not willingly participating. They are not willingly consenting. They are being compelled through force, fraud, or coercion. So every single encounter is a sexual assault or rape. And so when we're looking at that figure that I just gave you of 20 per day times 7 days a week, you are looking at about 140 rapes or sexual assaults every week. So the amount of trauma that they are experiencing is exponential and is approximately equivalent to that of war veterans. So who is targeted? It's a vulnerability, right? That is the bottom line. We understand that that is the common denominator, and that's why there is no prejudice or bias as to who gets recruited into the life. And I put that in air quotes because, again, that is another lingo or term used in trafficking. That is the common denominator. And every single one of us, let's face it, as human beings, we all have vulnerabilities. That's why there is no prejudice or bias as to who gets recruited into the life. It's a matter of whether or not that vulnerability can be exploited. And of course, some of them are socioeconomic challenges, lack of education, social media use, those high risk factors, right? Lack of attention at home. Perhaps mom and dad need to work. Sue is at home and she's on social media as a form of entertainment and distraction. Again, so some type of gaming platform. And these individuals are posing as peers even. There are devices that are used that can actually manipulate the voice and make them sound much younger. And so here they're starting that grooming process. Those who had a prior sexual assault, adverse childhood experiences, substance use certainly is one of those vulnerabilities because they are recruiting, right? And so where are traffickers recruiting? In schools, domestic violence shelters, homeless shelters, our Alcoholics Anonymous groups, Narcotics Anonymous groups, methadone clinics. They're recognizing that substance use disorder can be manipulated, can be held against that individual. And so here they're saying, listen, don't worry, you take that. I'm going to give you a place to stay. I'll give you a warm meal. And now what happens is they are actually holding that substance use, that addiction over that individual, saying, listen, you go do X, Y, and Z today, and then I'll give you your fix. It's also a way of keeping them in an altered state of consciousness so that they are poor historians. It can also be that individual is using that substance as a comfort-seeking measure because they cannot stand to live another minute in this life. Certainly, foster care, child welfare system, juvenile justice system, fairs, carnivals, large sporting events and venues. And again, that's another misperception, is that people think that human trafficking is happening more at these events. We know that human trafficking is happening 24/7, 365, right? But what these venues are providing, the Super Bowl, the Kentucky Derby, Sturgis, they are providing an environment where human trafficking can flourish. This recruiting is happening at the border crossings, migrant camps, as well as strip clubs. When we look at technology and trafficking, again, with that lack of geographical borders, everyone is online. And so here we have Minecraft, Roblox, Fortnite, Discord, Snapchat, Facebook. I know that you are all familiar with these, and we have those loved ones that we need to share this knowledge, raise that awareness, and make those around us understand how important it is. And through this mass dissemination, we can raise awareness truly at a global scale. So now when we look at human trafficking in healthcare, there have been two truly golden historical studies at this point. Chisholm Straker et al. From 2016 and Lederer and Wetzel in 2014. So these were retrospective studies looking to see different questions were asked. There were focus groups, there were quantitative measures taken as well. And so they were asking these lived experience experts, these survivors, diverse questions, but one of which was, at any point during your exploitation, the time that you were being trafficked, did you ever access health care? So approximately 70 to 90% said yes, I was seen by a healthcare professional during my trafficking, with the majority saying we were never identified, nor were we offered resources. So these individuals are coming in, accessing healthcare, unfortunately, due to the lack of preparation. The lack of preparedness of healthcare professionals. We are not readily identifying and therefore moving forward and offering services and empowering with choices and resources, or mandatory reporting for those cases involving minors. There are ICD-10 codes. A lot of healthcare professionals are completely unaware. I think I want to say they were established in 2018 or 2019, right? So several years at this point. These are the ICD-10 codes for sex trafficking. This is for labor trafficking. So there was a study that was done, and I see that there are questions, I'm assuming, coming up in the chat, and I promise I will get to them. But if there's anyone who wants to stop me right now for a pressing question, I'm happy to engage in that type of reciprocity. So does anyone have a pressing question now, or should I just keep going and hold it to the end? Okay, so
you can hold it till the end.
Okay.
Erin, but I don't know about the others.
Okay. All right. Thank you. Thank you for answering. Because right now, all I'm seeing is my title slide. I mean, my PowerPoint slide. So
I think just one thing, that we are an international club, and everything you're talking about is for the US. So some of that I would like to see at least iterated, that this is US statistics. Like you gave one slide and it gave dollars, which I know was US dollars, but was that just in the US, the numbers?
No, that was global.
Global. Okay.
Yes, that was the annual.
A lot of the terms we don't know because
Yes,
I'm in
understood.
Canada, and we've got people from Ghana and around the world. So
Yes, understood. Absolutely. But what I will say, yes, that was in dollars. That was the global revenue generated annually from human trafficking. Again, that was NASDAQ and Verifin that put together that report. when we look at healthcare concerns, this is universal. They are presenting in this particular way. I know that the laws are different. I was just giving the history, particularly of this country. A lot of people are unaware of truly how far back human trafficking dates. So thank you for that. So the ICD-10 codes for human trafficking use and frequency, there was actually a study, again here, US-based, looking at the 48 collaborating healthcare organizations and how frequently these ICD-10 codes were used. So there was an N of approximately 70 million. Of those, only 298 patients were found to have these ICD-10 codes in place. So it is 0.000427%. So again, really leading us to understand how we are not identifying these individuals. And again, thank you for expressing that. This is not just a US-based concern or issue. This is happening globally. They are being missed globally because across the world, there is a gap in education. There are gaps in legislation that mandate healthcare professionals being educated. And so when we're looking at healthcare professionals' preparedness, they are not being educated. Again, here in this country, we know that they are failing. My colleague and I specifically did a study looking at pre-licensure RN programs here nationwide. They are not being educated. 91.4% of our 644 that responded reported minimal to zero human trafficking content being taught. Likewise, their knowledge, they're reporting that they do not have confidence in knowing how to identify nor how to appropriately respond. And so again, this lack of knowledge applies to allied healthcare professionals, all healthcare professionals, and again, not necessarily just here in this country, the United States, but globally. We are seeing them, but they are invisible to us. What are some of those identification barriers? Diagnostic overshadowing. Once a diagnosis is made, those individuals, everything that they are presenting with, everything that they are manifesting in the clinical setting, they're going to say, meaning the healthcare professionals are going to say, oh, it's all because of the syncope episode or something along those lines. They are not taking that deeper dive to see what else is going on. Preconceived biases. Frequent flyer bias, which I hate that term, but frequent flyer means that it's someone who constantly is coming in, being seen, could very well be for the same concern. And so are we stopping to say, Patty, what is happening? This is the third time. What is going on? Can we talk about what maybe is bringing you in for the third time this month? Isolated, stigmatized populations, convenience, patient to provider ratios, lack again of knowledge, lack of screening tools and use of, lack of policies and protocols, and likewise, these victims do not self-identify. So what we're looking at with the red flags of trafficking, lack of eye contact, social interaction. Now, this certainly can be cultural, and we need to understand that. However, they really can present on the other end of the spectrum where they are aggressive, they are combative, they are not maintaining modesty, particularly those who are victims of sex trafficking. And so we need to, again, break away from that stereotype that these individuals are going to be very demure and very tremulous and not making eye contact, but can actually be very aggressive towards healthcare professionals. And we need to identify that that too could very well be a victim of human trafficking. Of course, fear of law enforcement and speaking with others. Transient living, although again, transportation is not necessary for it to be considered trafficking. They are not in possession of their IDs, their birth certificates, their documents, of course, developmentally appropriate. There's a history of truancy from school, running away, unexplained cash or gifts, being promised a better life, multiple hotel keys, multiple cell phones. Again, that's really what sex trafficking. Tattoos, these individuals are branded and they can be crowns, dollar signs, any type of moniker, Big Daddy. Again, that could be obviously American based. Names of these individuals. They're lying about their age. They truly do not know where they are. Really have a difficulty with gathering their bearings. Can also again be related to the substance use and that altered level of consciousness. Answers appear to be script or rehearsed. They are typically not allowed to speak for him or herself, particularly with that companion who is there. They are closely monitored. Please understand that those cell phone devices, they can actually, of course, and we know that they can be tracked. They can be used to listen to conversations. So we need to be cognizant of that. Poor living conditions and or living with their employer. They may report they have no control over their finances, owe money to a person that he or she is fearful of. Now, when we look particularly at that healthcare lens, through that healthcare lens and how they are presenting in the clinical setting, they can present with head trauma, seizure activity, syncope or fainting is what that is known as, diverse fractures to the face, to the nose, the eyes, the jaw, patterns in various stages of healing that can also be inconsistent with the history that they are providing. Domestic violence, intimate partner violence, right? Because these individuals are not self-identifying as victims. They are coming in with their spouse or reports of being injured by that spouse, that intimate partner violence, a significant other. And so again, they are being seen and labeled only as that, and they are not being recognized that they could potentially be a victim of human trafficking. They're presenting with poor hygiene, including dental, different types of dental concerns. Petechiae are red marks that do not blanch, so it's indicative of ruptured blood vessels. And so they can have it to the oral pharynx, which is the back of the throat. Temporal mandibular joint, that's that lockjaw syndrome. They can be presenting with gastrointestinal bleeds, dehydration, vitamin deficiency, malnourished, different, again, addictions, eating disorders, suicidality, somatic complaints, meaning that they're presenting with these different symptomatology, but there truly is no underlying physical cause for it, is a somatic complaint. Abscesses, infections, bite marks, burn marks, profound anxiety or claustrophobia in some of those diagnostic study rooms. Signs of physical abuse. Again, findings are inconsistent with the history. They can have vaginal as well as anal foreign bodies, tears or lacerations. They're coming in with diverse mother-baby concerns, ectopic pregnancy, meaning that the pregnancy implanted outside of the uterus and could be more in the fallopian tube or traveling along that route. Multigravida, which means that there is a history of multiple pregnancies, pelvic inflammatory disease, sexually transmitted infections, urinary tract infections. I recognize that I use a lot of the acronyms here, so that's why I'm providing what those signify. They're struggling with addiction. Again, that is a huge vulnerability. Near overdoses, neonatal abstinence syndrome, mom who was being trafficked was using, and now we have baby who was born withdrawing. Are we stereotyping? Are we asking mom what is happening? Or are we just saying, well, she was a user and she couldn't stop during her pregnancy, and now we have baby born withdrawing? breast cancer, cervical cancer, all related to that PTSD, that constant fight or flight that they are experiencing. Plastic surgery, forced or involuntary. Oh, go ahead. Is someone asking a question? Just if anyone who is in the healthcare professions has relationships with healthcare professionals, please, I really ask of you to share this